welcome back. I hope you all enjoyed the sessions that you attended earlier today. I know for my part, as a reporter, I've already met about 10 people who I'm going to be calling and plumbing for more information because they gave me story ideas. So from my perspective, this is just going great. I have the pleasure to introduce two gentlemen whose names have become synonymous with cannabis in this country, Andrew Freedman and Louis Koski. Andrew Freedman is the co-founder and senior director of Freedman and Koski Incorporated, which is a first-in-the-nation consulting firm working with government, research institutions, communities, and private businesses to get cannabis legalization right. So Mr. Freedman's role in developing a successful operating model for cannabis regulation and stakeholder collaboration was identified by the Brookings Institution as one of the reasons for Colorado's success in implementing recreational marijuana legalization. He holds a JD from Harvard Law School and a bachelor's degree in philosophy and political science from Tufts University. Louis Koski is the other co-founder and senior director of Freedman and Koski. He was the director of Colorado's marijuana enforcement division during the legalization of marijuana, and he is nationally and internationally recognized as an expert in formative marijuana policy. He's among a small group of government executives who have been intimately involved in the development and implementation of marijuana policy from the infancy of medical marijuana through the realization of legalization. And he wanted me to say that he is better dressed than Andrew. I'll leave it up to you to judge. Gentlemen?
Wow, can you guys hear okay in the back? So I'll get us kicked off here. Thank you so much for the kind introduction. I can tell you from my perspective that this is really an honor to be here speaking in front of this group. Andrew and I have been working together for probably close to 5 years right now, 2 of which is with the company Freedman and Koski that Dan was talking about. And a couple of years ago when I was still in government service, Andrew and I had a lunch and we were talking a little bit about our experiences so far, and we mentioned that a number of government agencies had kind of reached out to us to see if we could be helpful in implementing their policy. And from that, Andrew kind of started to build a vision for the company for a company that we could start together and try and go to as many government agencies and really advocate for good government processes around cannabis policy. And man, am I glad I did for a couple of reasons. One is we've had an opportunity over the last couple of years to work with literally dozens of government agencies and companies that try to help government promote good government practices. And I know there's a couple of people here in the room that we've worked in the past, and that has been absolutely rewarding. And then secondly, it's just been really amazing being able to work with Andrew this last couple of years. He's don't tell him I said this, but he's really brilliant and he's very, very good at what he does, and I've learned a lot from him. So I guess what I'm trying to say here is if you can find yourself a nerdy, super nerdy policy wonk that looks like he's 15 years old and he wants to go start a business with you, go for it.
That was a great introduction. Thanks, Louis. So in our 5 years, this is the first time we've kind of done this Statler and Waldorf routine, and so before we got started, we were like, hey, what if we come up with ways to like gently make fun of each other before it starts? And all we came up with was ways to make fun of me. So didn't have anything going the other way. This is one of our favorite summits. This is the second time this summit has happened, and can we get a round of applause for AHP for putting this together? Honestly, when they went for the second round, from the moment this one ended 2 years ago, we've been talking to them about how they put it together again, because this is the only chance for so much public health talent to come together and help form visions going forward. And we're not paid anything to be here, so we're just actually telling you that this is, if the visioning doesn't happen here, it's not going to happen. And so the tone we want to set today is that there's so much important public health work that has to happen in the world of cannabis legalization over the next couple of years, that we need your help to be the political and policy action that brings it through. We want to give you a lens with which to view how you can actually pursue those actions on both the state and federal level. So when we talk today, it's going to be essentially in 3 parts. First, we're going to talk about where the cannabis discussion is right now on the state-by-state level, how it's generally viewed by the public, and where the public debates are. We're going to talk about where you can see it in the data and what you guys can do to help influence the debate in the right directions. The second thing we're going to talk about is more unresolved parts of state policy issues, the kind of evolution of these state programs that are kind of more ripe because people haven't been quite as set in stone on where it should go, and where we hope, again, you will weigh your voice in on where it should go. And then the third one is going to be the federal landscape, and I will tell you that is changing really, really quickly right now. And so I think there's some pretty scary stuff happening. I think there's some pretty exciting stuff happening, but if we don't start coming together with a vision at a summit like this, it's going to run away from us. And so we're excited to dive deep. Where we decided we would start first is talk about how legalization is being graded. And we like to talk a lot about not how it should be graded or what is the best solution, but really what is going on the ground level. And so when we talk, and again, we've been across the country on this, when we are involved in public conversations, these are the 4 issues that come up: youth use, poison control center calls or emergency room calls, driving while high, and tax revenue. Those are the 4 issues that come up. I will notice, I think, probably talking from your point of view, there's some things missing there that seem, really important. There's a whole bunch of public health messages around pregnant and breastfeeding. There's this huge issue of substance abuse. There is a pantheon of drug issues that are not on the screen right now that I will tell you, you have to get them there. It's not immediately on the conversation level of where people are starting. These are the 4 issues. And so the very first one, like clockwork, if you walk into a new state, the very first thing they're going to ask you about is youth use and where the debate goes. So the first thing you'll hear is, I'm very concerned about the youth use. And the advocacy community or the people who are in favor of it will pretty quickly show data that shows, according to national health surveys, either flatlined use or decreased youth use past 30-day use since legalization implementation in states across the country. By the way, all the data we are using today is from Colorado, only to show because there's such long-term data because we're so familiar with it. Again, we're not here to tell you this is right, that there's been a decrease in youth use. We're telling you the perception quickly moves to new places when they're grading how legalization is going, that youth use is considered a bright spot of legalization working. There's a pretty quick gloss over adult use and consumption rates, that there is maybe some talk about 18 to 25-year-olds using more. There's a little less talk about 26 to 34-year-olds, and then people really like to point out that there's been an increase in 65 and older, but it obviously is not the biggest thing in the world to talk about. And what I would say is I look at that data and there's some questions that come up, right? That's a pretty big last year increase, right? And so are those heavy users? Are there more heavy users? Are heavy users using more heavily? All of those are great questions. I will tell you that the general perception is, hey, we expected all these things to double or triple. And so this is great news. And there is no show here. And so again, just the general perception of where we are with consumption rates is good news on the youth use spectrum, and on adult use, kind of nothing to write home about.
So I guess I didn't realize we weren't getting paid.
Yeah.
So I should ask some more questions. I just learned that. Andrew was talking a little bit about consumption rates. I think largely the public views that data that Andrew was talking about in terms of consumption rates as being pretty positive. But at the same time, the public doesn't really necessarily believe that cannabis legalization is without its harms. In fact, if you look at the slide that's up here right now, you're looking at calls to the Poison Control Center, where we see a pretty steep increase in the number of Poison Control Center calls after legalization in Colorado. And the reason why we even bring that up is when the public looks at that, they look at that and they say, yeah, that looks to me like as a result of legalization that there might be a problem there, and they probably look at it as a problem that needs to be resolved, but it's a little bit more nebulous to them in how it's going to be fixed. When we look at it from like a regulator standpoint or a public health standpoint, we look at it and go, wow, there could be lots of problems that are causing this issue, and so we might look at it and say, wow, maybe edibles, we need to take a little closer look at our edibles regulation. Are the labeling requirements right? Do we have the right level of packaging? Should we look at maybe doing on-product markings? And so we look at that, just that one thing, but we also start looking at it and we go, well, what if it also has to do with concentrates? Maybe the potency level in concentrates are so high that we should be worried about that, and let's start putting some regulation to that. In addition to the regulatory side, we might even look at this from a public health perspective and a public education, and we might be thinking, well, with that big of an increase, maybe we're seeing overconsumption by new consumers in the marketplace, or we're concerned about accidental ingestion by children. And so because we look at it much more deeply than the general public, the number of policy solutions that we have could end up being relatively large. And the larger that suite of policy change becomes, the more likely you are to see opposition from a regulated community or people that are proponents of legalization. And so the other piece I think that's important to keep in mind is even though the public generally sees cannabis as having some potential to be harmful, they see it as being less harmful than alcohol. And this slide right here, from a regulator kind of public health standpoint, can be a really frustrating set of data, because even if it were true that cannabis is safer than alcohol, it can really frustrate some of our work, because that doesn't necessarily equate to, if cannabis is safer than alcohol, then all of the regulations should be more permissive than alcohol. As part of that flawed argument that's out there with respect to cannabis and alcohol, we think, from a public health perspective, that what we should do is like have this big, sweet conglomerate of regulations that we put together, and the public sentiment around it may be strong enough that it's really difficult to get all of that done at one time. And so it might be better to think of it in terms of like, what are the little pieces of that puzzle that we can be effective at pushing over the short run, recognizing the fact that even though this is frustrating, and that the argument around it that we might see from industry is flawed, that they're probably going to win that argument. And when they win that argument, is it trying to just get some small steps forward, or is it trying to advance all that public policy at one time? So this data is FARS data, or fatal accident reporting data. And as you see in this data, you see an increase essentially of drivers involved in fatal accidents testing positive for cannabinoids after the wreck. And when the public looks at this data, they're reminded of a bigger problem, or they're reminded of the persistent problem of impaired driving generally, not just with cannabis, but they're also reminded of it with everything else that falls into that spectrum. And so to a large extent, there's a fair amount of public support for trying to make changes to public policy for DUID. The challenge, though, is, and what often happens is, we see what looks like a problem on this data, and the tendency is to try and go back for a second. The tendency then is for us to try and craft policy that's focused on, or otherwise perceived by others as really being an attack on legalization, rather than really trying to work on the DUID problem. And Andrew and I, our experience, especially over the last couple of years, would tell us that you could be pro-legalization, or you could be neutral on legalization, and you could still see the DUID data is showing a problem. And so what we say is, even though as like a regulator group or a group of public health professionals that we have here in the room today, we can look at this and say, yeah, well, we've got public support. Let's really try and push the policy that's important to us from a DUID perspective. Or what we could do is we could look at opportunities to actually be able to partner with some of those stakeholders like industry and come up with solutions that craft the policy in such a way that you're not just looking to attack legalization, you're actually really trying to get to the specific problem, which is the DUID policy. So this is an example here of why you probably don't want to go tit for tat with industry on DUID policy. This essentially is state-by-state data that shows fatalities per 100,000 population or 100 million miles driven. And what you see is a correlation with states like California and Colorado that are both legal, where they're either at or below the national average, and then there's other states that are like Arkansas who have who do not have permissive cannabis policy, and their average death in both those categories is considerably higher. And so again, with the focus here and the point we're trying to get across here is that when it comes to DUID policy, the policies should be about the problem of DUID, not necessarily trying to make it a part of or a problem with legalization.
And the last thing that people always want to grade cannabis legalization on, and maybe actually the first thing and maybe the only thing, is tax revenue. That is extremely frustrating from our point of view, but it's true and we should all acknowledge it. And as much as I get up and I say, hey, listen, this makes up for less than 1% of the state budget in Colorado, it's not nearly as often as the newspaper will run a number that says that Colorado made $250 million in tax revenue for marijuana without the following sentence, out of a $36 billion budget. But that, it's a losing battle to try to convince people that government isn't in it for the money. First of all, no one believes you. And second, the scales are just off, and no one knows how to say, oh, that's not a lot of money, because $250 million is a lot of money, and it wasn't there before. The way I think it's really important for public health to weigh in on this debate is everybody wants that money to go to schools, roads, things that cost billions of dollars, multiple $1 billion to solve. The extra $150 million you might have left over from this fund is not going to make a dent in those kind of problems. Meanwhile, there are very good public health programs that can be pushed with this kind of money that otherwise would not be seeing funding. And so I urge you to really think those through and actually approach your governor's offices, your legislative budget offices during the time where this money is a little bit more up in the air and say, if you put it into education, you're going to be blamed in 2 years because education won't look any different. And everyone's going to assume you mismanaged the money. Meanwhile, if you put it into actual substance abuse programs, we will be able to point to very real progress that has been made that otherwise would not have been made. And so there's a really valid argument. The kind of programs that we were approached to in the governor's office in Colorado from the public health atmosphere, from the public health folks, were always my favorite. Always got top of the billing list when we were going through everything from homelessness solutions to diversion programs that put kids into public health programs earlier rather than later. All of those ended up at the top of our list, and we really did thank them at the end because those were politically a much better way out of the conversation than why haven't you solved our education? Why does my school still not have a gym? So that's the conversation that we're at today. This is evolving on the state level day by day, and so we thought we'd give you what we see as kind of the 4 key issues, not even key issues, 4 issues that we're going to be dealing with over the next couple of years that, again, kind of the sooner this group has a point of view and vision about what to do with them, the more you can be weighing in with where there's going. So I'm going to let Louis handle the first 2, and I'll comment on the last 2.
Yeah, so it started with on-site consumption and special events, and really both these are actually 2 distinctly different challenges because of how they're usually designed. But on-site consumption and special events represent a category of unresolved policy that is very, very difficult to find the right balance. And we see a lot of policy alternatives being advanced on both of these. So just kind of like focusing on the on-site consumption piece of this, some of the challenges you see is for example, where is the product going to come from? We've seen ideas that have suggested that the cannabis should come as a bring your own cannabis style consumption place, to having to, on the other end of the spectrum, having to actually have regulated cannabis from the regulated community providing that product. We've also seen concerns advanced about that are things related to like alcohol that we know that are established, not the least of which is being able to determine whether or not you serve to somebody who's actually like physically impaired. I don't know if you guys know this or not. You probably do because you're public health. And alcohol, if you can't serve somebody who is physically impaired, and where there's really good data behind what those signs and symptoms are, they're not as well established on the cannabis side. And so there's opportunities there within that particular unresolved policy for us to really participate in that. And my guess is just as I threw some of those ideas up, you're already starting to think to yourself like, well, yes, of course we would use regulated cannabis, and we probably want to maybe even think about whether or not we want to allow them to smoke cannabis in this consumption area, or if they're just going to be able to use edibles. And so there's a lot of things from a public health perspective that really get invoked when you start talking about on-site consumption and events. And I'll just say a couple quick things about events. Again, comparing it to alcohol regulation, a lot of the ideas that we've seen advanced on cannabis style events are actually far more permissive than what we allow for in a lot of alcohol regulatory frameworks. And so there's always the concern then too that you end up with policy that allows for both cannabis use and alcohol at either the same event or the same place where you're allowing for on-site consumption. And then just a couple comments about delivery. Delivery is really interesting because it's essentially taking the point of sale that's normally at a storefront and extending it to the consumer's front porch, right? And so there's, when you think about that, there's all these concerns that kind of get invoked about how you're going to be able to still continue to keep track of that inventory, what safeguards are going to be in place if there's not video cameras and other safeguards to ensure that this isn't just a shoulder tap to get cannabis to someone who's underage. So again, seeing as how these are both under or unresolved policy issues that are still getting debated, I think there's like we're on our 4th year in a row in Colorado of trying to tackle the on-site consumption issue. There's still the opportunity there for all of us to really be able to participate and help to shape some of that policy.
So this is more of a beg from me than anything. The potency debate is the hardest one when it comes to government. Every other substance in the United States, I think this is really interesting and why cannabis is so different than everything else. Every other substance is guilty until proven innocent. You need to come to the FDA with loads of information. Depending on how you feel about the FDA, they make an informed decision on how this can be used by a user, what a typical user does. There is many protocols in place for making sure that substances are safe before they're being used by the general public. That doesn't exist for cannabis, and mainly it doesn't exist because the federal government wasn't allowed to do anything with cannabis for so long that those frameworks don't exist. And so what we lack for potency is a language to even think about potency. And that is so hard when it comes to government deciding what to do. How do you ban something based on potency if we don't even have any science behind that? We don't know what users generally do. We don't know if greater percentages of potency mean that you get greater amounts of THC in your system, whether or not those are titrated at the same rates. We don't know what the impact on the brain is, if any different. And so we need your help developing potency. There's kind of no two ways about that. Both pushing for the sort of data and research to be inherent in the systems as they move forward in the regulated system, with some signposts that say, if bad data comes up, we have to roll some of these back. I would even suggest thinking through, I know Rhode Island is thinking this through, starting with a kind of go slow mentality of pulling back on some of the more potent cannabis in the system, but really also just an interim framework for us to even think about potency. What is, and again, this is language we're going to be asking from you guys, what is kind of not as risky marijuana? What is more risky marijuana? What is high risk marijuana? What should be accompanying those in terms of warning labels? What should be kept off the shelves? What should be only sold out in single-use doses? There's a whole bunch of work around potency that has to be a little bit guesswork for right now, that the only people who can do that guesswork is the public health officials. And so that's a little bit of a leap of faith and a little bit of a begging on my part, but this is a really big part of the system that's missing that really does require your input. The last is not nearly as unique to cannabis. It actually is unfortunately something for almost every issue, which is that the detrimental effects of legalization are felt most acutely by poor, low-income neighborhoods, and the economic upside development of cannabis legalization is felt most acutely by affluent, rich neighborhoods. Again, nothing, that kind of everything goes through that system. The unique thing about cannabis is, since part of the messaging around this has been that it's a response to the war on drugs, and is supposed to be in some way reparations for the way these poorer communities were torn apart, it does offer an opportunity for public health officials to come in and really push health equity programs that otherwise wouldn't see the light of day. And so one place where I would urge you to be creative is to really think through what are some of those health equity programs that is like kind of your wildest dream that you could get that passed through the state senate. Because this might actually be one of those opportunities, because they are, everybody kind of has a little bit of egg in the face when they look at the data afterwards and they say, yep, we benefited rich white people and we put all the retail shops in the poor black neighborhoods. And so it's really a place to think through what are some of those kind of more far-reaching health equity programs we can put through. So this is in no way rocket science, but this is what I would say I would hope you guys will walk away on the state level thinking through. One is just, what is realistic goal setting for your regulatory systems for what you wish to see in the states? And what is some data that you could force your government to be keeping track of? Because that's what's going to set up your debate 5-10 years down the road when you say, this is what we wanted to accomplish, and have we accomplished it? And all the data you said we didn't have last time when we came forward, now we have the data. So think through what you want to see. Second, and this is a little bit more unique from where Freedman and Koski come from this, but public health officials should be paying more attention to the regulatory technology that's being put in place. Whether it's inventory tracking, point of sale technology, that technology to date is our best data that we have. And regulators are using it on a day-to-day basis to make sure that places are compliant. But public health officials should be asking that data to be able to speak to their systems, to be able to tell you, oh, well, it turns out we are selling concentrates at a massive amount more between the hours of 6 p.m. and 9 p.m. in these low-income neighborhoods. The really helpful information is in there that if you guys are aware of the regulatory technology and the kind of data it's capturing, you can start asking to have access to that data. And the third one bleeds a lot into the second one, which is you should have a data plan. There is this debate, you start off so far behind because the amount you have to prove, again, cannabis is kind of innocent until proven guilty. The amount you have to prove in order to put on kind of normal amounts of regulation is just not available. And so how do you start collecting that data now in order to make good, reasonable guardrails going forward? So if we were giving this speech 2 months ago, we would be moving to question and answers right now. That this is what you could be seeing in the state level. Here's where we think you could best weigh in. The federal landscape, we would just not have talked about very much. Here's all the ways you have to bypass federal agencies in order to have a legal marijuana product on the US level. That's the FDA on the outside, and that's the DOJ on the inside. those are the two ways that it's illegal, both the the Federal Drug and Cosmetic Act, and it's a Schedule I substance. Nothing has changed on that literally forever, or I don't know, the last 100 years, and we don't expect to see much change. In fact, federal government kind of, the most change it does is kind of commit to inaction. And so the Ogden memo, the Cole memo, the Finson memo, Rohrabacher, Blumenauer, were all just different ways of saying, we're not going to act. And different levels of, we're not going to act because there's not going to be any money, we're not going to act because of prosecutorial discretion. It was a forgiveness versus permission model. And that was kind of the most the federal government was going to weigh in. That is all very much changing. If no one has told you these last couple of months have been different, let me tell you, these last couple of months have been different. Money is coming into the system right now. The Farm Bill was, I think, the crack in the system that has changed whatever tipping point the federal government needed to be okay with making money from cannabis happened with the Farm Bill. When Mitch McConnell signed the Farm Bill, he did it with a hemp pen and said, look at this great hemp pen, because there's a huge market for hemp pens. He did not mention CBD. He knows that he legalized CBD. So this is not a secret that CBD oil was the impetus so that when Kentucky's growing hemp, it's not growing hemp for hemp pens, it's growing hemp for CBD oil. But he didn't have to talk about the FDA at all. So they legalized, they went past, if you look at this, they got rid of, that got rid of this inner circle. He just didn't even mention the FDA. That wasn't even a problem that was going on at this time. The FDA has since looked into it, and they are starting their own work group process. If you haven't read the letter from the commissioner of the FDA, I do suggest you read that, because there are ways to get involved in how FDA is going to be dealing with CBD and THC derived from hemp. But it wasn't part of the discussion. We also have the Attorney General from the incoming Attorney General Barr mentioning very quickly and kind of to no fanfare, we're just going to go back to the Cole memo. So there's this feeling like, hey, we're back into the staging ground right now with both cannabis and hemp, that we are about ready to start going with something, and everyone's positioning a little bit. It's maybe a year premature, but things are about to happen. The States Act was kind of the States Act I don't think was supposed to be real this year. I don't think anybody thought it would get to the floor. Show of hands if you know what the States Act was. Okay, that's important for me. Show of hands if you understood what I was talking about the Farm Bill. Okay, good. All right. So the States Act, bipartisan support, Cory Gardner, Elizabeth Warren put forward this idea that let the states regulate marijuana. Whatever they decide to do is legal. They get to bypass anything. If you read it closely, and no one has really pointed this out, it actually says that the FDA will have no jurisdiction over cannabis, which I don't think anybody has thought about until now. Do we really want a system, right now the FDA isn't doing anything about state legal cannabis, but do we really want a system where we have now determined the FDA will have no jurisdiction over cannabis? And so all of this is happening right now, and it is being war-gamed. So these are the recent companies that have decided to get into cannabis. We all knew this was happening somewhere in the background, but here it is in real life. Altria, that's your tobacco. Novartis, that's your pharmaceutical. InBev, that's your alcohol, have all made significant investments now in cannabis. And you are kidding yourself if you don't think that they have a war room full with really expensive friends of mine who went to Harvard Law School and are deciding how best to go through the legalization process to get through the rings of FDA and to get through the rings of Schedule I. Some of them might say, hey, we just want to get Schedule I, we still want the FDA to oversee us. Some of them might say, we don't want the FDA involved or the DEA involved. And they're all posturing right now, and they have tens of millions of dollars of lobbying money kind of ready to go. So we are asking you guys, the David against the Goliath, to start putting together a vision of what you would like to see for federal cannabis legalization. Our food for thought of what to focus it around is the 80-20 problem, which is, I'm sure all of you know, and I'm sure this is me I'm sure my naivete in this situation is laughable, but 20% of the product is used by, 20% of the users use 80% of the product. You see something very similar with alcohol, you see something very similar with tobacco. I think when we dig into the numbers in Colorado, it's more like 30-70, but the idea that a very small percentage of the total group is using a very large amount, which means that when you're looking at how to maximize value within this industry, you're going to really figure out how to get every last mile out of that 20 to 30% of the users who are really going to go after the product. And so how do we protect and put the kind of regulatory guardrails we've learned in place to really protect those 20 to 30% and not allow the system to go overboard and really, look like 1960 style tobacco? That would be our suggestion about the unifying theme that we should be looking at when we talk about what a federal system should look like. And there's going to be some uncomfortable moments with that, because we're going to have to go back to our own programs and see how much have we gotten it right along the way. And so one of the problems I'm going to bring up, this is really uncomfortable to talk about, is the Colorado medical marijuana program, also in the Constitution. We expected to see over time people leave the medical program and go into the adult use program. And there was some of that. I mean, that is definitely a lower point than that, but not as much as we thought we would see. And my guess is what's happening. One of the ways you can get a medical marijuana card in Colorado is severe pain, which I think last time I looked it up, about 92% of people qualify for it for severe pain. We've essentially set up a buyer's discount if you want to buy in bulk. If you are a frequent heavy buyer of marijuana, you go into the medical program because there's no taxes there. There's actually a small tax, but there's nowhere near the adult use tax rate. And so this is some pretty perverse incentives. And especially if you consider that public health, one of the things that you have as a leverage is to be able to help control the prices through taxes in order to prevent abuse, right? In order to push back against heavy users and make sure they don't use as hard. So is this a system we want to keep? Do we want medical systems in general that are making pretty darn near close to health claims, right? That normally you would have to go through the FDA, but right now the medical programs can list a lot of things without having to talk about what are potentially negative side effects. Should all medical marijuana start going through an FDA process? Those are all questions that need to be answered, that if you don't answer them, these people are going to answer them, and they all have specific reasons to answer them that might not be in the best interest of the public. The last things we want you thinking about, and then we're going to take questions, is really just some general questions that we think should be food for thought for you for how you might want to look at federal legalization. The first is, what are going to be the incentives for research and FDA approval? This is kind of curtailing with my previous comment, but if medical marijuana, state legal medical marijuana can kind of continue unabated and it is in fact legal under federal law, what sort of incentives will pharmaceutical companies have to go do research and to go through FDA approval? Will we see essentially no research at all going forward on cannabis on a kind of rigorous model, and everything will end up being more anecdotal? I think interstate commerce here we're going to talk about.
Okay, yeah, thanks. So interstate commerce is really not just about moving cannabis from one state to the other. It's really about moving all of the requirements that go along with that cannabis from that state to another state. It can also be a lack of requirements that come from one state to the other. So as we start thinking through what the federal policy might look like if it continues to advance forward, like Andrew's suggesting, we probably should be asking ourselves, is interstate commerce something that we want to be part of that initial round of federal legalization? Or is there need to be a period of time where we can really start to think through what some of those public health and safety concerns might be from moving product from one state to the other? Is it going to be properly refrigerated? Again, Andrew was mentioning earlier about the possibility of no FDA standards. What are the standards going to be then on refrigeration of product that needs to be refrigerated? What are the standards going to be for ensuring that that product stays in its original state when it leaves one area and goes to the next. So there's a lot of questions there, even though you wouldn't think of interstate commerce necessarily as a public health and safety issue, because there's so much disparity and different approaches to how states are tackling their comprehensive set of regulations. There could be some challenges that stem from that.
One of those challenges might be a price collapse, right? That I think we wouldn't be the first people to tell you that this is an agricultural commodity, and maybe without having to abide by a state regulatory program and track every plant so rigorously, you might actually see a price collapse. So if you are going to have interstate commerce, what are some ways we're going to have some price controls in here? I saw where's Pat Oglesby? I always like to look at. He'll talk your ear off about why there should be weight-based taxes coming in, and you should talk to him about it. He's very smart. But what sort of price controls are we actually going to want on a federal level to be able to push back? Should we end up seeing some price collapse? What sort of tobacco-like advertising do you want to see? I will tell you, the States Act had nothing about advertising, and nobody was talking about it. And do we want to go further? Do we want to take some of the voluntary programs, push the boundaries of the First Amendment, and really see what we can make mandatory for cannabis? None of these conversations are happening right now. And I will tell you, next year, there's going to be, I would dare to say, $40, $50 million worth of lobbying money that's going to go into all these cannabis-related bills. And if we don't have a point of view, no one's going to have a point of view. So really, I think we need to get on top of that.
So I think the last thing that we're going to talk about here is what things do we want to preserve from all of these state systems? So if you look at from the West Coast to the East Coast, up into Canada is not as relevant because of our federal change, but there's just so much effort, so many resources that go into creating the policy and implementing that policy on a state-by-state basis. And sure, there may not be one right answer on how exactly to do it, and sure, there's a lot of disparity probably in how states have been addressing all of this. But as we start thinking about what that federal legislation or that federal approach may look like, and it starts to come into focus, we really should be asking ourselves, what are those things that have occurred in states that we really want to be able to preserve? What are the roles and responsibilities going to be for state actors, and what are the roles and responsibilities going to be for the federal government? Because it's entirely possible that the federal policy could be designed in such a way is that it's really unclear who's supposed to be watching over certain all the aspects of the regulatory framework. And so we think it's really important to be able to identify and look at things where we're starting to develop best practices around labeling or packaging or inventory controls, and really ensuring that those get either preserved and stay the responsibility of the state, or they get preserved and overseen by the federal government.
So if nobody told you that a starting gun has gone off, the starting gun has gone off. We are very happy that there's such a positive approach, a response about coming to a summit like this, but I really do urge in the next 48 hours, start making the connections to tackle some of the issues we've brought up today. And again, our job is just to try to help connect you to policy change makers. We are really looking for you guys for the ideas of what should be going forward. So we have about 10 minutes left. We'd love to take some questions.
All right, folks. Thanks so much. That was a great keynote. I wanted to just reinforce one thing you said. I just recently attended a industry investment conference in Miami, and what you said about big cannabis is absolutely true. With the players that we think of today as being the biggest players in this space are really just trying to prepare themselves to be more appetizing when the real sharks and whales come along, and consolidation and scale were the two things that kept coming up over and over. So I think you're really right to underline that. And so with that, I'm going to turn it over to our questions from the audience. And again, if you could just identify yourself, and if you're associated with the group, just let us know what that is. Thanks.
I'm Barbara Herbert, and I'm a physician, which is always an interesting place to be, beginning to talk to lawyers. But if we assume not just that the reason that people who got medical marijuana in Colorado wanted better tax breaks, but that in the middle of an opioid epidemic, where the best treatment is only available in states that have Medicaid expansion, and there is no insurance payment for this, that this may actually be a functioning way of taking on the opioid epidemic and an alternative to thinking about what we're doing, which I have no idea how we would make happen. One would be to ensure people who were trying to get off of a different problem, because we do have good data about pain, about nausea and vomiting, and you know, I mean, the IOM, the old IOM, now the NASEM, did the best review in the world of data. We have data about when it medically works, but we can't actually get access for anybody with health equity. So a very interesting idea would be that if you began by getting a doctor's note, you went back to the doctor, and there was some way for the doctor to be paid, or nurse practitioner, or whatever provider, not just out of pocket. Because we're in the middle of one epidemic that we might be able to resolve in some ways, but that is totally crippled by the fact that we have no way to pay for care in many of the states that have the worst care. Do you have any ideas?
I love the comment. First of all, I think we absolutely have to be creative about the ways in which we are going to reconcile the federal system, how it normally acts, and the state systems, which are now pretty far down the road. And I don't mean to say that it's all negative, right? It's not all buyer's discount for substance abusers. I do think that there's some very good data out there from a lot of other users in the opioid epidemic, epilepsy. I mean, there are a lot of good things there that we can't just decide we're going to throw away tomorrow because we need to all wait through the FDA process and suddenly bring a halt to all these things. So I think it's a good idea to think through how do we change the way we're looking at data collection around this and pursuing data collection. I think we might need to start thinking about more right to try laws or expanded access laws. There has to be a way to bridge where we are right now and how people are using it with the research that's going to be needed. And we have to also think through what is going to be continuing incentives to do rigorous research along the way. So I really do invite your thoughts and love the idea that you're thinking through this creatively.
But if we don't have government support for payment, and we don't have big pharma support for payment, which we may not want, who is going to pay for care? It seems to me this is a kind of canary in the coal mine about a whole series of healthcare problems that we haven't taken on.
I don't disagree. If you have another 3 hours, I think we should talk through it. But I do think that it's part of the issues that need to be talked about today.
I do just want to make sure that we get to everyone. If we can keep the questions to maybe like 30 seconds or so, and try to just make sure we get a direct question to them. Thanks.
Okay, my name's Gilbert Mora. I work with Behavioral Health Services and Rethinking Access to Marijuana, a coalition of public health people. First off, Andrew, love your socks.
See,
Are they made of hemp?
He did say that.
You know, I work also a lot with alcohol, and we have an agency in California called ABC, and they fall into this trap where all licenses are rammed through because they need the fees to be operating, and they're operating on a budget that is like, they're still in the paper and pen age, and they're always underfunded and understaffed. How can we ensure that marijuana doesn't fall into the same trap where they're beholden to the fees and, you know, are turning a little bit of a blind eye because they need the fees and allowing things to happen and not enforcing like they should?
So if I understand the question correctly, I actually lived through this in the early days in Colorado before we actually did adult use, where we were really struggling to get licensees fully licensed. They were allowed to operate until the point that they were licensed. And then over time, since we collected application fees up front but not licensing fees, we were really struggling from a budget standpoint to get companies licensed. So what we really had to do is we were kind of put in a situation where as we were continuing to start get momentum for licensing and collect licensing revenues to keep the system or the program solvent, there was a lot of accusations about whether or not we were cutting corners to get those businesses licenses. So I've kind of been on that end of it. And the reality was, for us, at least at the time, was that our scope of background investigation, which I was 100% responsible for, was too big. It was kind of based off of casino gambling, and we were trying to do everything that we did to get a casino license. And I think to respond to your question, I think the right answer is to find the balance. What should that scope of work be pre-licensing that you work on that is going to cover the requirements that are in legislation to be able to move those out the door. So that's one thing is scope. And then the other thing that I would say too that's important is it's probably best for these programs not to be funded primarily from licensing and application fees. And so we corrected that when we transitioned out of the medical program and incorporated the adult use program, so we had both of them. We changed it to where a big chunk of the budget that was coming to the Marijuana Enforcement Division was coming from the tax revenues that was collected from the sales. And so it kind of it created this distance between the work we had to do and kind of helped to really preserve the objectivity because our funding source, we weren't accused of licensing businesses anymore for the purposes of keeping people employed at the division. We had the right scope for the processing, and we had the right funding mechanism that created the separation and the oversight that we needed.
This is a good plug for our lunch that we're hosting tomorrow. What we messed up, which I was originally, the original title was What We Effed Up. But Linda Frazier said that was too risky. So what we messed up in Colorado and what we would have done differently going forward. So.
Incidentally, Linda also said not to mention that.
Oh.
So